This can be with back fractures post-surgery. It can be soft tissue damage too also, but when they talk about spinal precautions, it can be cervical, thoracic, lumbar, or sacral. And what they're talking about typically is edge of bed, possibly sitting restrictions. Maybe somebody can't sit up. They're limited how long they can sit up. And then no bending, lifting, and twisting. And they call this BLT. So no bending, lifting, twisting. And that means no bending over to pick things up, no lifting anything heavier than 8 to 10 pounds, which is a gallon of milk. So I always tell patients that. And that also, when you say no lifting, that means no pushing. So a loaded up cart at Costco, we wouldn't want Hal to do that. And then twisting is any twisting motions beyond kind of the center and where you're moving. We don't want to have any lateral movement, so bending or twisting this way, or rotational movement. So that's BLT. So the first place we start to do this is teach patients in bed when they're getting up and moving around. It's the perfect time to go over log rolling and their spinal precautions of no bending, lifting, or twisting. So we'll start with log rolling. And Hal's a little high. Let's lower Hal down. There we go, Hal. That was a quick ride. So Hal, what we're going to do is roll and sit up on the edge of the bed. But with a log roll, your hip and shoulder move together. So no twisting to get out of bed, no putting your feet out first, no just sitting up straight in the bed. We're going to roll towards Lara, and then we're going to sit on the edge of the bed. Okay? So Lara, I'm going to move him a little bit towards me, though, first, because he's close to that edge, and Hal is big. Hal is bigger than the bed, so we want to have our center of gravity where we can use the best. There we go, Hal. So with a different style of bed, we would be able to, thank you, we would be able to maybe let Hal use the bed rail, but then we have to be careful because that's that lifting. How do I know if he's not going to be pulling more than 8 pounds? So, and then patients don't have bed rails at home, so maybe we don't want to teach them to do that. Maybe they won't have that, so we may as well teach them how to do it without. So Hal, we're going to roll towards Lara. What I want you to do is bend both knees up. Help me bend both knees up. There we go. Excellent. And then we're going to reach across. Remember, no twisting. You're going to roll like a log, which Hal does very well. All righty. Ooh, that break. Fantastic.
All right. You okay?
There we go. All righty. So now, Hal, we're going to bring your feet off the bed and your shoulder. I got shoulders if you want to do feet.
Okay, ready?
Ready, Hal? 1, 2, 3. Push and sit up. Great. Great job log rolling. And just sit here. Make sure you don't feel dizzy. This is a cervical collar. There's many on the market. Your facility or wherever you are, where you work, wherever you do field work may have a different one. There's Aspen. There's all sorts of different ones. So this is called a Miami J. It's probably one of the more commonly used, but like I said, the principles are the same. So to get it started, it'll come in a pack. The orthotist or the prosthetist will come and deliver this. It is delivered by them, and they'll set up and they'll check fitting, so the pads will already be on it when you get there. There's packaging that tells you all about the pads and how to clean them. You get an extra set of pads, so that's really, really nice. So there is a front piece and a back piece. I think the back piece looks like a little bit shaped like a heart, and that's the back piece, and so this is the front piece. So you put the back piece on first, and what I'm going to do is I'm going to help Hal take his pillow out and make sure when he's laying flat in bed. Now keep in mind our mannequin has a little extra cervical extension. But what you do is take the back piece and you're going to flatten it as much as you can and maybe get the straps out of the way so they don't rub against the client or your patient. And I'm going to use this to slide this under Hal's neck. And so that he's in a good spot. So landmarks are kind of, you don't want it down too far down underneath here because now this isn't going to be on the occiput. So you kind of want to have this hit the landmarks of just that bump at the back of your top of your C-spine. So it gets the base. We want to be hitting them right in here with these. And you put it on, and if it's not quite right, it doesn't fit right, you just put it on again. So now I'm going to take the top piece. I'm going to fit it in here. Do one side, do the other, and kind of make sure we got it in there. Hal is going to tell me this is way too tight, and that's the idea of it. Just making sure, yep, that looks good. Alrighty, and our Miami J collar is on. So for teaching purposes, I'm going to take this off to show you. So when we're talking about the occiput, we're talking about those two bumps right about here. That's where this is going to line up to support the base of the neck. So, and then keeping the pads. And OTs, I find, are always the ones that figure out that these pads need to be washed and changed. So that's usually our job. Part of a spinal precaution that's particular to cervical is no lifting your arms up above your head for any extended period of time, or to do any weightlifting or any pushing or pulling, getting things out of the cupboard, towels or anything. I think doing your hair is probably okay, but you don't want to get your arms up in a position where you're going to get cervical strain. So there's a limitation on that. And depending on how high the thoracic injury is, that might be the issue as well. It's always good to check with the surgeon.
So what we're going to show you now is a lumbar sacral brace. And the idea is if someone has to keep their spine immobilized out of bed, then they have to put this brace on. So in bed, they don't have to wear it, but when they get out of bed, they have to have the brace on. Now, this is a prefabbed one. And so you might have, you might see one in the hospital where it's a custom one, and it looks kind of like a white turtle clamshell. And the difference, too, is this one you'll see once it goes on will only go up to the lumbar sacral area. They could also be higher and go up to the thoracic area. So we're going to show you how you put on this brace before you get someone out of bed. Okay, so I have Joseph, my helper, and the first thing we're going to do is just do a log roll over towards me. So are you ready, Hal? You're going to roll towards me. 1, 2, 3. So he's going to place that. Now when he looks at the bottom of the brace, it's going to be at that sacral level. Just like that. Can you show them where it is? Sacral, so maybe here. Perfect. And then we're going to roll him back on. Is it pretty centered? We're going to log roll him back over to Joseph to see if it's centered. Go ahead and grab him there. Yep, it looks good. Perfect. Okay. So that's the back piece. So now we're going to put the top piece over here. This brace, the top part only is going to be protecting the lumbar and sacral area. There are also braces that are a lot, that also have a piece that also goes over the thoracic area called a TLSO, which is a thoracic lumbar sacral orthotic. This is just a lumbar sacral orthotic, an LSO, basically. Okay, so a couple of things. We want to keep this nice and tight. So as we get ready to tighten the brace, we're going to ask them to fill their stomach, just like that diaphragmatic breathing. So we're going to say, Hal, can you fill your stomach? Good. And then once he does that, we want to have the pressure in terms of tightening at the same time. So you ready? Yep. Pull up to have even pressure, and then tighten. So just to reiterate, you can think about the top part going over the bottom part, kind of like a shoebox, or we call it a clamshell.